UT Physicians would like to welcome you to our patient self-assessment video series where today we will be reviewing the hip. To begin, please find a location in your home where you can take 5 consecutive steps. At a natural pace, please walk forward and backwards, reporting any difficulty to your healthcare provider. Next, please point with one finger to the area of the hip where you experience the most pain. Now, put your hands on your hips and find the top of your pelvis. Walk your fingers down to the front where you should feel a bony prominence. Press firmly and report any pain you may find. Next, walk your fingers down to the front of your thigh as shown in the video. Walk back up to the bony prominence and then diagonally towards your groin. Next, return to the bony prominence in the front and walk the fingers down towards the side of your hip. You should feel a bony area near the outermost part of your hip. Once you find it, press firmly around the edges of the bone. Lastly, walk your fingers down to the back and press firmly on the bones where you sit, as shown in the video. Now we will look at the motion of your hip while standing. Start by standing next to a chair or wall and follow along to the motion performed in the video. If you have too much pain or difficulty balancing, please skip this section of the video or report these difficulties to your healthcare provider. Next, we will look at the motion of your hip while sitting. Start by sitting in a firm, high chair if possible. Follow along to the motions performed in the video and report any difficulties to your healthcare provider. This part of the assessment will focus on how well you can actively move your hip in all directions. Please start by lying on your back with one knee bent as shown in the video. Keeping your knee straight, you will slowly raise your leg to the height of your bent knee and then slowly lower it back down to the ground. Repeat this 5 times and report any pain or difficulty. Next, roll onto your side and lift your top leg upwards as shown in the video. Be sure to keep your knee straight and to not let your leg come forward. After performing 5 repetitions, roll onto your stomach. Keeping your knee straight, try to lift your heel about a foot off the floor without rolling or arching your back. Again, repeat for 5 repetitions. Lastly, roll onto your side again with the top leg bent as shown. Keeping your knee straight, lift your bottom leg upwards about a foot off the floor and repeat for 5 repetitions. This part of the assessment will take a closer look at how your hip joint is functioning. Start by lying on your back and slowly raise your knee as close to your chest as you can. Once you feel restriction, grab your knee with your hands and add a little pressure. Next, pull your knee up and across your body as shown in the video. Now, take both hands and gently try to compress your hip by pressing through your knee. Keeping that pressure, move your hip in a circular pattern as shown in the video. Be careful not to press too aggressively while performing this test. Lastly, cross your ankle over your other leg just above the knee as shown in the video. Let your knee relax down towards the ground, opening up your hip joint. The final part of the assessment will require you to perform a squat. Stand with feet shoulder width apart and feet slightly outward. Without letting your heels come off the ground, squat as low as you can and repeat several times. This completes the hip self-assessment. Thank you for your participation and allowing us to be a part of your healthcare journey. The testing you performed will help your healthcare provider determine an accurate diagnosis and prescribe appropriate treatment to get you feeling better as quickly as possible.